But what does this mean in the fight against COVID-19 in Nigeria? I'm now being joined in the studio by a public health physician, Dr. Ayo Oluwole. Thank you for joining us.
Thank you, Nita.
There's new guidelines that have just been put forward. What do you think? Is that what's required now?
Oh, so thank you. I feel that, as we all know, that COVID-19 is an evolving disease condition, and we continue to see how this has panned out as we continue to see over thousands of cases that we have seen since the first day that it was introduced in the country. And so this has necessitated, and of course with WHO guidelines and technical support, has necessitated this new turn in our protocol for management. We know that if someone is infected with the virus, it takes about 3 to 8 days, okay, for some manifestation of the virus. And then we know that transmission is at best at this point in time when someone develops symptoms. So when someone is asymptomatic throughout the period but was tested positive, it is assumed, and of course with evidences we've found, that it's unlikely that this person is at the peak of transmission of the virus. And indeed, this person may have had some remission after 14 days.
Okay, so it's a little over 100 days since the first case was confirmed in Nigeria. Yes. But the country's response, now, between then and now, we've had positive laboratory network increase from 2 to 30. Yes. We had negative about 5,000 births to over 8,000 active cases. Would you say it's a product of the response pattern, the way Nigeria responded to this?
Yes, at the beginning of the pandemic, at the beginning of the response, you know that we've sat here to discuss that we can only find what we search for, okay? And I think we know, okay, that there might be a lot more persons in the community, as was evidenced by the admission that there was now a large community transmission at the time. That if we had intensified or ramped up our testing, which in any case we still need to continue to do, we will find cases amongst the population. So we are seeing the results of having to have moved from 3 or 2 centers in the country to 30. And hopefully, if we continue in this path and we're able to at least put a testing center in a state, for instance, we will find that we will still get more numbers, okay? So, and hopefully, of course, hopefully we might get new numbers, but hopefully if we also, on the other side, follow protocols and guidelines of prevention, we might have a downturn or flattening of the curve.
Okay, so far, 777,000 people have been tested in a little over 100 days. You're saying that if we have...
74,000, you mean?
77.
77,000, yes.
Over 76.
Yes.
We found out that 77,000 have been tested so far.
Yes.
But let's look at the case in Kano, for instance, where verbal autopsy said that between 50 to 60% of those deaths we're hearing about 937 people were COVID-related. Is it a testing site there, a testing location there that will make it easier to manage the situation?
Okay, so there were some, as we know, there were some delay in seeking for help at that time. You know that there was a peak around April, and then you find that there was some delay. This, and of course, with the culture of burying of persons who had passed on in those areas, it was difficult to, at the early phase, to determine what was caused. It was when people who were burial specialists that were burying cases and they saw that the numbers had increased, that was when it blew off. Okay, so we know that if there had been some response before then, okay, and there had been some guidelines that have been followed before them, we might not have seen what we saw. Of course, that has changed, and you see the Honorable Minister telling us that there seems to be some stabilization following interventions by technical partners in the
But
state.
those mysterious deaths are also happening in places like Yobe State, for instance. Would you say it's the same thing?
It might be the same pattern. It might be the same pattern. Like the Honorable Minister said, 60% of these cases were found to be COVID-19 related. Okay, so some deaths occur in the community. People who do not have access to go to the health facility, who have all other disease conditions, as we found every part of the country, have also died at this period, okay, and are not directly linked to COVID itself. But looking at the large number of persons who had died around this time, and then the lack of intervention at that point, it is safe to say, and of course with the technical partners who have joined in investigating these deaths, come up to that, and hopefully we will not have this situation again in the country.
Hopefully, indeed. The NCDC DG talked about more focus on the states and how they are managing the situation. But we'll look at the NCDC numbers when we come back from this short break. Do stay with us. Thank you for staying with us, our special COVID-19 studio update. Now, before we went on that break, we were speaking with Dr. Ayo Oluwole, and we talked about the fact that the NCDC DG said that going forward, the focus will now be on the states. The state epidemiologists need to get up and get into the SAC if they've not already been doing that, but they have to increase their participation and involvement. But all over, we're having the East lockdown. Yet the chairman of that task force says Nigerians are still susceptible. From your point of view, what do you think the states might need to do to ensure that the spread is minimized?
Yes, thank you. I think that this was long overdue to have decentralized the response to the states. And I totally would understand that we never had this large situation that was almost overwhelming, because at the time it was overwhelming for the NCDC also. You look at the laboratory and you heard the Honorable Minister talk about the capacity for the laboratorians, okay? So they've gotten from a 2-lab situation to a 30-lab, and how to fill that up was a challenge. So in going back to the states, yes, I believe that the states at this point would also need to continue to build capacity, human capacity, infrastructure capacity. And this on the long run is going to help each state, okay, as we go on. We know that eventually, as data managers have said, we might have to look at the situation where COVID-19 stays with us for a pretty long time. And then the management, the case management, the follow-up, the contact tracing will fall back on, especially at the local level, at the district disease surveillance and notification officers to the state epidemiologists. They have garnered enough, at this point, enough capacity, and they would also need more to continue continue the response. So in terms of movement across states, each state will now have direct view over what exactly is happening in their states. Of course, with still technical partners from the NCDC, from the Federal Ministry of Health, will be able to support each state to build capacity on their own going forward. Because it was an emergency, but at the stabilization phase, we should build across board a lot of capacity for us to move on eventually.
Thank you so much. Dr. Ayo Oluwole is a public health physician. Thank you for sharing this.
Thank you, Doctor.